Hey guys, so I chose the topic of benefits of acupuncture, and I chose this because I thought it would be interesting to look into something that I might want to try in the future. And I know some of our classmates have actually said that they've tried this when we were talking about it in class, and one of our classmates said that her mother had actually tried this as well. So I thought that was pretty interesting. And I just wanted to kind of start off with what acupuncture is. And it's basically, people know it for being these little needles going into your skin, and that's what it is. It's this pricking of needles, and um, the brain sends signals which releases endorphins, and it's basically acting as a natural painkiller, which can be strong as morphine. So I thought that was pretty cool. And we can date acupuncture as far back as thousands and thousands of years ago. Um, One of the like founders or inventors of acupuncture is the Chinese emperor, which is where acupuncture actually comes from. Um, China. It comes from the traditional practices of Chinese, and so I thought that was pretty interesting that we're still using this today. Um, so then I wanted to talk about who benefits from acupuncture, and it's going to be more commonly used for something as your back pain and carpal tunnel, but it can also be used for things such as helping your digestive system, which is going to be something like gastritis, or your emotional being, which will be like anxiety, or even something like insomnia. But the most commonly used form of acupuncture is going to be for treatment of musculoskeletal problems, which is going to be, again, your pains and aches on your joints, or again, your lower back. But the one that I thought was really interesting is the neurological one, is going to help with someone that is diagnosed with Parkinson's disease. So I thought that was something that I wanted to look into. And so looking into that, I found that um, the long-term use of L-DOPA is not really going to benefit someone with PD. So people with PD typically tend to switch to something more natural, where we're going to see acupuncture come up. And what it's going to do is help reduce tremors in someone with PD, and it's going to be able to allow them to have a natural, easier lifestyle, and will typically just let them have a better feel of life. So, with that came another study with acupuncture, and it's basically just finding out that acupuncture releases endorphins and will reduce pain that people experience. And the thing is, there's not a lot of studies going on about acupuncture because it's really hard to conduct a study like this. Um, the reason for that is, really, when you're trying to study something like this, there's no way of studying it. People are trying to figure out how to measure pain, and that's one thing that's going to be different within each individual. So, um, it's also going to act as a placebo. So, someone going into a session for acupuncture is going to go in with the mindset of, this is going to help me, especially if this person has done their homework and had taken the time to actually look into acupuncture and read maybe reviews that people are leaving online, or watching videos. Um, so that effect takes in with them going into the session thinking, I'm going to come out of this session feeling a lot better, or I'm going to not experience very many pains coming out of this. So that's one of the reasons why people go into acupuncture, and that's another reason why the studies are not that great on this topic. Um, Moving on from that, I wanted to touch on the subject of acupuncturists, and people tend to rely on acupuncturists on giving them diagnosis, which is not something that we should be counting on, especially because acupuncturists are certified in their field. Um, they're going to typically go to an accredited college or take a course where they're going to practice Oriental medicine. So it's not a good idea for you to go into the office of an acupuncturist and ask for a diagnosis or to ask to be cured of something as strong as PD. But there will be some cases where you can find doctors that practice acupuncture, so it's not something that is very uncommon to find. Uh, so I wanted to move on and touch on the video that I put into the presentation, and it's initially a video of a man that went in for his second session of acupuncture. He's in with a doctor, and he's talking about how he's gotten better just by going through one session, and it's really just the doctor going through motions with him, like having him stand up and do certain exercises. And I thought it was a really good example of how acupuncture can help someone with PD, especially since that was the topic that I was kind of drawn to. And so I thought that was pretty cool. But also in the video, the doctor, well, the acupuncturist mentions that he's not his neurological doctor, so he's basically doing these practices with him to report back to his actual doctor, which I thought was really interesting that he included and made sure was something that was clear for the patient, that he's not his doctor, but he's going to help him through the process. But yeah, so that was basically my presentation. I included my resources in the PowerPoint, so feel free to look at those. Thank you.